Welcome back to the Deep Dive. Today we're cracking open a topic many of you might be curious about, maybe even considering for your own skincare journey. Microdermabrasion.
Yeah, it's definitely one people ask about.
We've taken a deep dive into a really comprehensive source for this. It's essentially a client's guide, packed with key points.
That's right. And think of us as your guides through this stack of information.
Yeah.
Our mission today is to pull out the absolute most crucial details, maybe some surprising facts, and help you really understand what this treatment involves. So you can figure out, if it's the right move for you.
It's like getting the inside scoop without wading through all the technical jargon.
Exactly.
We're going to follow the path a client would, covering everything from, like, preparing for a session, what actually happens in the chair,
Right.
the crucial aftercare, and what kind of results you can genuinely look forward to. And maybe some you shouldn't expect.
It's all about moving from just being curious to feeling, confident about it.
Okay, let's unpack this, starting with the absolute basics from our source material. At its core, what is microdermabrasion? Like, what's actually happening to the skin?
Okay, so simply put, it's a non-invasive cosmetic procedure. It's really all about exfoliation.
Exfoliation.
Yeah, specifically using a special device to gently remove the outermost layer of dead, kind of dull skin cells.
And what are people typically hoping to fix with this? What common skin concerns does it target?
Well, we learned it's primarily aimed at improving the texture and appearance of the skin surface.
Okay.
The source mentions it helps reduce the visibility of fine lines, mild scarring maybe from old acne, age spots, and just general unevenness in skin tone. It's really about revealing that fresher, brighter skin underneath.
So surface level stuff mainly. Is this something anyone can just go and get?
Well, it's suitable for a pretty wide range of skin types, which is a big plus.
That's good.
However, the guide does point out it tends to work best on light to medium complexions. And this is important. If you have certain active skin conditions, like rosacea, eczema, or even, active acne or a fresh sunburn,
Right.
you'll likely need to hold off. Or you might not be a candidate at all. You definitely don't want to irritate skin that's already compromised.
That makes complete sense. So, okay, if you are a good fit, the next step, according to this guide, is doing your homework and getting ready. This sounds absolutely crucial.
It really is. The first layer of research is checking credentials. You want to make sure you're seeing a qualified professional, either an esthetician or a dermatologist.
And the equipment matters too, right? It's not just about who's doing it.
Exactly. You need to confirm they're using a sterilized, professional-grade machine. That's key.
Okay.
The source also highlights there are two main types of the procedure. Crystal microdermabrasion, which sprays tiny crystals onto the skin.
Right.
And diamond microdermabrasion, which uses a diamond-tipped wand. It's actually worth asking which method they use. One might be better suited for your specific skin type or, your concerns. Knowing that difference is a really key insight from the guide.
Looking at reviews and before-after pictures seems like a really smart, practical step the guide suggests too. Helps manage expectations, I guess.
Totally. And understanding the cost upfront is necessary, of course, but also realizing that results aren't magical after one session.
Right. Not a one and done.
No, it's gradual. The source really emphasizes knowing the recommended number of sessions in a course. The results build over time. They're cumulative.
Right. Setting that expectation early is super important. Now, shifting focus a bit to getting yourself ready. What does a client need to do in the days leading up to the appointment? There are quite a few specific points here in the guide.
Yes, there are several key prep steps. The guide advises avoiding tanning and waxing in the area you're treating for about 7 days beforehand.
Okay, a full week.
Yeah. And you absolutely must be upfront about any skin allergies or sensitivities you have.
Makes sense.
And share your current skincare products with the technician. They'll likely tell you to pause using potent ingredients like retinoids and certain exfoliants for a few days before.
But ease up on anything aggressive you're using at home. And sun exposure, that's a big no-no.
Oh, a major point. Avoid direct sun exposure for at least 48 hours before the procedure.
Got it.
Hydration is also stressed. Drinking plenty of water in the days leading up really helps your skin be in the best possible condition.
Okay, hydrate, avoid sun.
Then, on the actual day of the appointment, cleanse your face gently, skip any harsh scrubs, and do not apply makeup. Come in with a clean face.
Got it. Clean, hydrated, makeup-free.
Oh.
What should the listener expect the moment they arrive at the clinic, that initial check-in?
Right, so first, the technician will take a good look at your skin. They'll assess its condition and just confirm you're good to go for the treatment.
Okay.
And for the procedure itself, the guide is pretty clear. You should expect a mild tingling or maybe a scraping sensation, but not pain. No anesthesia needed for this.
Okay, good to know. Let's move into the treatment room itself then. What's the experience like once you're settled in?
Well, you'll typically be lying comfortably on a reclining chair or maybe a treatment bed.
Uh-huh.
They'll cover your hair, protect your eyes with goggles or pads, safety first, always.
All right.
And the very first step is usually a thorough cleansing of your face. Got to make sure it's a clean canvas, remove any leftover oil or dirt.
And then the main event with the device. How does that work?
Yes, this is where the action happens. A handheld device is passed over your skin in small, controlled strokes.
Okay.
And like we mentioned, this is either spraying those fine crystals or using that diamond-tipped wand to mechanically exfoliate the top layer of skin.
And there's that crucial suction component you talked about earlier. That happens at the same time.
Precisely. That's the dual action.
Huh.
While the device is exfoliating, it's also simultaneously using suction to lift away the loosened dead skin cells and debris.
Ah, okay.
That's a key difference from just, say, scrubbing your face at home.
What does that combination feel like? Is it uncomfortable or just kind of weird?
You know, the guide often compares the sensation to a light scratching or maybe a very gentle sandpaper feel.
Sandpaper.
Yeah, but gentle. It's generally described as painless, though areas with thinner skin or maybe more sensitivity, like around the nose or eyes, might have a stronger tingling sensation.
Right.
It definitely varies from person to person based on their skin's sensitivity level.
And how long does the actual treatment part usually take?
The session itself is relatively quick, typically lasting between 30 to 60 minutes. Depends on the areas being treated, I suppose.
Can they focus on specific areas that might be more problematic, like if you have more texture somewhere?
Oh, absolutely. The technician can make multiple passes over areas with more texture concerns or maybe pigmentation issues.
Okay.
And you can often extend the treatment to the neck and décolletage areas too, not just the face.
Good to know. And what does your skin look like during the treatment? Does it get really red?
It's normal for your skin to look a little pink or flushed during the procedure. That's expected.
Okay.
And a key point to remember again is that there are no needles or injections involved here. It's purely a surface treatment.
Right. No needle.
And you're totally able to talk to your esthetician throughout the session too, so you can give feedback on how things feel.
That's good. You can communicate.
Mm-hmm.
And immediately afterward, when they stop.
Right after the device is put away, the guide mentions that a cooling or soothing gel might be applied, just to calm the skin down.
Nice.
And you'll likely notice that your skin feels immediately softer and looks, well, brighter, a bit of a glow.
So you get a little immediate payoff. That's encouraging.
Yeah.
And a major plus we keep hearing about is the minimal downtime.
That's a huge benefit, yeah. There's essentially no real downtime. You can return to most normal activities right away.
Oh, okay.
Some clinics might finish the treatment with, say, a calming mask or a serum application, always followed by a gentle moisturizer, and this is absolutely crucial, sunscreen.
Sunscreen is definitely the recurring theme here, which leads us perfectly into essential aftercare. The source guide puts a lot of emphasis here. What can you expect right after leaving the clinic and what you absolutely need to do?
Okay, so expect some mild redness for about 1 to 2 days. The guide compares it to a light sunburn, which is a pretty good analogy.
Okay, like a mild sunburn.
Yeah. You might also notice some slight peeling or flaking. That's completely normal. It's just those dead cells shedding. Your skin might also feel a bit dry or tight.
So that post-treatment redness and maybe fleeking is just part of the process.
Exactly.
And let's talk about the sun again. Sounds like it's an even bigger deal after microdermabrasion.
It is absolutely critical. The guide stresses avoiding sun exposure for at least 48 hours after the treatment, minimum.
Right.
And ongoing, you need to use a high SPF sunscreen daily, every single day. Your skin is freshly exfoliated. It's much more vulnerable to UV damage.
Okay, daily SPF is non-negotiable. How does your regular skincare routine fit into this aftercare picture? Can you just go back to normal?
No, not right away. For the first few days, you need to stick to only very gentle cleansers and moisturizers.
Gentle only.
Yeah. You'll need to avoid using harsh products like retinoids, strong acids, or physical scrubs for at least 3 to 5 days, maybe longer depending on your skin.
Okay.
Generally, the guide suggests you can resume your regular routine in about 5 to 7 days, but always follow the specific instructions from your technician. They know best.
What are some other specific things the guide warns against doing in those first few days?
Oh, yeah, there's a list. Avoid applying makeup for 24 hours unless your technician specifically gives you the okay.
Got it.
Steer clear of swimming, saunas, and anything that causes heavy sweating for about 48 hours.
Okay, no gym then.
Probably not ideal, no. And this is a key one. Do not pick or scratch at any flaking skin. Let it shed naturally. Picking can lead to irritation or even scarring.
Ooh, good warning.
Avoid hot showers, too, and any exfoliating tools like brushes or cloths. And hold off on waxing or threading any facial hair for about a week. The source also suggests avoiding smoking and alcohol for 24 to 48 hours as they can hinder healing. And be cautious about scheduling other aggressive treatments too close to your microdermabrasion. Give your skin a break.
That's quite the list of don'ts.
Yeah.
Are there things you should be doing to actively support the healing process?
Yes. Keep drinking extra water. Hydration from within really does help skin heal.
Okay.
Consider using calming or repair serums. Ingredients like aloe vera or hyaluronic acid are great for soothing the skin.
Nice.
Use clean pillowcases, especially that first night. Try to avoid touching your face unnecessarily. And if you do have any significant redness or maybe a bit of swelling, a cold compress can help bring that down.
Those are great practical tips, and probably don't plan a big photo shoot or important event the day after, right?
Exactly. The guide advises against scheduling important events the same day or even the day right after your treatment. Give yourself that buffer.
Makes sense.
The ultimate takeaway for aftercare is really this. Follow all the specific instructions your technician gives you. They know your skin. They know the treatment parameters they used. Listen to them.
All right, let's get to what everyone really wants to know. The results. What can you realistically expect, and how do you keep those benefits going? The guide is pretty clear. Results take time.
That's a crucial point, yeah. You'll likely notice that brighter, smoother feel after the very first session, which is definitely encouraging.
Okay, some instant gratification.
Well, a little bit.
Yeah.
But the full impact, the significant improvements, those really build over multiple treatments. It's a cumulative effect.
What does a typical course look like to see those bigger changes? How many sessions are we talking?
A common recommendation is usually a series of about 4 to 6 sessions.
Okay.
And they're typically spaced about 2 to 4 months apart. This gives the skin time to recover between treatments while still progressively improving things.
And over those sessions, what kind of specific improvements tend to become noticeable?
So the source lists several key benefits that build up. Pigmentation, like sunspots or melasma, and mild acne scars can gradually fade.
Nice.
It's also effective at helping unclog pores and reduce blackheads. That's a big one for many people. And it significantly improves overall skin texture and tone, making it smoother and more even. It can soften the appearance of fine lines, too. We even learned it can sometimes help with mild stretch marks and those little bumps known as keratosis pilaris, those rough patches often on the arms.
Okay, P. Interesting.
Yeah. The guide suggests you'll typically start seeing noticeable improvement after about 2 or 3 sessions.
But it's also really important to understand what microdermabrasion can't do, right? Manage expectations.
Absolutely. It's not effective for deep wrinkles or moderate to severe acne, especially cystic acne.
Okay.
And it's definitely not a substitute for more intensive treatments like laser resurfacing or cosmetic injectables like Botox or fillers. It's working at a different level, much more superficial.
So, great for texture and surface issues, but not for deeper structural concerns. That makes sense. Once you've completed that initial course, how do you hold on to those hard-earned results?
Maintenance is key. You'll typically need follow-up sessions, maybe every 1 to 3 months. It depends on your skin and your goals.
Okay, I'm going.
Yeah. And the guide absolutely emphasizes that maintaining results long-term relies heavily on a healthy lifestyle and a consistent, proper at-home skincare routine. Sunscreen every day.
There it is again, sunscreen. The source also mentioned some less obvious benefits, didn't it?
Yes, for instance, because that top dead skin layer is gone, your skin becomes much more receptive to your serums and creams. They'll actually penetrate better and work more effectively.
Oh, that's a cool bonus.
Yeah, and repeated treatments can also help stimulate collagen production over time, which contributes to firmer-looking skin in the long run. It's noted as an excellent treatment for prepping the skin before special events, gives you that nice glow. And for some clients, after several sessions, they gain enough confidence in their skin's appearance that they feel comfortable going without makeup sometimes.
I could see that.
Tracking your progress with maybe a skincare journal or even just photos is a good way to see the subtle changes you might otherwise miss day to day.
That's a great point. Any final warnings about maintaining these results? Something to watch out for.
Just mainly be mindful of over exfoliation between your professional sessions. You're getting controlled exfoliation during the treatment.
Right.
So you probably don't want to be using harsh scrubs or other intense exfoliants too frequently at home on top of that.
Okay, don't overdo it.
Yeah.
Let's wrap things up by hitting some final crucial considerations. Risks, limitations, and maybe some common questions the guide covers. We touched on who it's for, but it's worth briefly reinforcing the suitability points.
Right. So safe for most skin types, generally. But specifically with the crystal type, there's a note that it may not be as well tolerated by all skin tones compared to the diamond method, something to discuss.
Okay.
And again, avoid if you have active skin conditions like acne, eczema, sunburn, or any open wounds. Definitely wait until those clear up.
What about potential side effects people should be prepared for? Anything common?
Well, the source mentions that you might experience temporary breakouts as your skin purges itself. It can be frustrating, but it's sometimes part of the process for some individuals as things come to the surface.
The purge.
Okay. Rare but possible side effects could include hyperpigmentation again, that's darkening of the skin, which just highlights why sun protection is so vital.
Definitely.
Or even rarer, infection or bruising, but those are not typical.
That hyperpigmentation risk really underscored that sunscreen message again and again. Any medical history points people need to be aware of or mention?
Yes, it's vital to inform the clinic if you have a history of herpes or cold sores. The procedure could potentially trigger an outbreak, so they might want you to take preventative medication.
Good to know.
The guide also states it's generally not recommended during pregnancy without getting explicit consent from your doctor first. Always best to check.
Okay.
The source also notes, and this is important, that the final outcome can depend quite a bit on the skill of the technician and the quality of the equipment being used.
No. Well,
This just loops back to why that initial research we talked about, checking credentials, checking the clinic, is so important.
and doing it too often is potentially a problem. You mentioned maintenance, but is there a too frequent?
Definitely. It should not be done too frequently. Overuse can actually lead to thinning of the skin over time, which is the opposite of what you want for healthy, resilient skin.
Right.
The guide also advises caution with those at-home microdermabrasion devices unless they've been specifically recommended or approved by your dermatologist. They might not be as effective or could even cause irritation if used incorrectly.
There are other skin treatments out there that sound kind of similar, like dermaplaning or chemical peels. Does the guide clarify how microdermabrasion is different?
It does make a point to distinguish them, yeah. Microdermabrasion is different from dermaplaning, that's the one using a blade to remove hair and skin cells.
Okay.
And it's different from chemical peels, which use chemical solutions to exfoliate. They all work in different ways, have different ideal candidates, different depths, and different outcomes, not interchangeable.
And clinic safety is obviously a must. What should people look for?
Non-negotiable. Always ask about their sterilization practices for the equipment tips. Ensure the treatment room looks and feels clean and the environment seems professional overall.
Good advice.
If you're nervous about how your skin might react, especially on your first visit, the guide recommends asking for a patch test beforehand, just doing a small hidden area first.
Smart idea.
Yeah.
When is it a sign that something might be wrong after the treatment and you should maybe call them or see a doctor?
The guide says if your skin feels like it's actually been burned or if it's excessively painful in the days following the treatment beyond just mild sensitivity or tightness, that's definitely a sign to contact the clinic or a dermatologist.
Okay, don't ignore significant pain.
Exactly. And a quick practical note, since it's considered a cosmetic procedure, it's typically not covered by health insurance, so you need to factor that cost into your planning.
Good point to be aware of. And finally, who benefits most? Is it for everyone?
Well, it's effective for both men and women. It's often seen as a really great complementary treatment to an existing skincare regimen, particularly for people focused on anti-aging goals or just improving overall skin texture and brightness.
The overarching theme that really comes through in this guide, I think, is definitely listen to your skin.
Absolutely. That's maybe the most important takeaway. If your skin feels unusually sensitive or reactive after treatment or even between treatments, that's a signal to take a break, maybe reassess your aftercare or talk to your technician. Don't just push through it.
Wow. Okay, we really did a comprehensive deep dive into this client guide. We've walked through pretty much everything, from deciding if microdermabrasion is even for you, how to research and prepare,
Uh-huh.
what the actual treatment feels like, those crucial aftercare steps, the results you can realistically build towards, and also the important considerations like risks and limitations.
Yeah, the goal here was really to distill the essential information from this source. So you feel knowledgeable, maybe more empowered, whether you're just curious about it or actually getting ready to discuss it with a qualified professional.
Thinking about how a treatment like microdermabrasion, by focusing on refining the surface through these consistent sections, can lead to those cumulative positive changes in your skin. Kind of makes you wonder, doesn't it? What other seemingly small, consistent practices in our lives, maybe related to health or personal habits or even learning, might also have significant cumulative positive effects over time that we perhaps underestimate?
That's a really good thought to ponder. Something small, done consistently, adding up to a big difference. Definitely food for thought.